We know that the population is growing older. Men and women, both gender, become older, and an important part of their health, also in old age, is sexual health. We do know from studies that sexual activities decline and that sexual problems increase in men and women. In men, it's mainly problems with erection, erectile dysfunction, but also premature ejaculation, problems with the orgasm. And in women, it is very frequently diminution of sexual desire, arousal difficulties, but also pain during intercourse or pain during masturbation. So these changes are related to age processes, but also related to diseases which occur more frequently with increasing age. So there are a lot of possible medical factors that contribute to these changes, but also psychological factors and relationship factors. Therefore, it is important that we offer to elderly individuals and couples a care which is characterized by a biopsychosocial approach. That when the individual or the couple comes in, we try to understand what their problem is. Is it a change in needs that maybe in the past they were more interested in sexual pleasure, now they are more interested in intimacy? Is it a love problem, a relation problem? Is it a problem of loss of function where they want to have help? So we try to establish, first of all, a comprehensive diagnosis of the sexual problem in the individual and also in the couple. How does the couple interact with each other? How do they try to help each other to solve the problem? And then very often after these counseling sessions, which include also some help for talking about the needs, talking about the difficulties, which may be the first time that the couple is really starting to talk about it. Then after this first sessions, we very often can find out if we can have some medical help. On the male side, it's very often drugs that improve erection, or that may also help for premature ejaculation, but also good counseling, how to integrate it into the sexual foreplay or into the sexual interaction. For women, it may be the local treatment of vaginal problems with local estrogen. It may also be some replacement therapy for postmenopausal women, or it may be some hormonal treatment even for premenopausal women. But very often the mainstay of the therapy is really what you could call sexual counseling, helping the partners to understand better their needs, possible differences in their needs, possible conflicts they have about their needs, and help them to resolve these conflicts and also to build up a new sexual relationship, which may be quite different from what they had before, and which includes what we sometimes call sexual rehabilitation, that sex is much more than penetration, and that they also include, for example, what we call sex toys, which would help them to get maybe more aroused, to make sexual interaction more pleasurable. So it is very often a combination of medical help, psychological help, which can improve the quality of sexual health of the elderly couple.